The GVSU Interprofessional Simulation Center is a centralized service at Grand Valley. The center and all its equipment are accessible to all of Grand Valley's faculty and staff in over 20 different health-related academic programs. As an interprofessional center, students have the opportunity to learn with, from, and about students in other academic disciplines in events specifically designed to be interprofessional in nature, while still addressing core curriculum content within each student's program of study. There are 3 service areas within the Simulation Center. Traditionally, the assessment laboratories are where students work on the development of their hands-on patient care skills through the use of task trainers. The high-fidelity mannequin events are where students work with highly specialized patient simulators, and standardized patient events where students have the opportunity to complete assessments on community members who are trained to portray specific medical cases. There are several assessment laboratories, each offering slightly varying equipment. Students are assigned to specific labs within the center based on course objectives and the equipment needed to meet those objectives. Some labs are equipped with hospital beds, outpatient exam tables, or therapeutic mat tables. One unique feature offered is a video streaming system designed so that faculty can teach a specific skill, especially fine motor skills, like suturing, and it is broadcasted to each student's individual workstation. Grand Valley students also have the opportunity to learn using task trainers, including both hands-on and virtual platforms. Whether learning how to conduct physical exams, start IVs, recognize heart, lung, or bowel sounds, practicing wound care, catheterizations, or other skills, Grand Valley students have access to equipment to practice and perfect skill performance. Students can also check out equipment from the Simulation Center to practice at home. Grand Valley has invested in a wide variety of task training mannequins. This particular mannequin is a 3D image of a real person. Students can practice CPR, intubation, catheterization, feeding tube insertions, and IV starts using this mannequin. In addition to this, students are able to practice patient transfers, as this particular mannequin's weight is distributed similar to a real human. One of the many highlights of the Simulation Center is the inpatient suite that looks and feels like a real hospital. In this suite, students partake in simulated patient care encounters with either standardized patients or high-fidelity patient simulators. Grand Valley has numerous pediatric and adult high-fidelity patient simulators. Super Tori is a newborn patient simulator that is completely tetherless and can be programmed for a wide assortment of human conditions. Athena has sim eyes, which can be programmed to have dilated or pinpoint pupils. The eyes can be bloodshot or even show signs of jaundice. SimMan 3G has medication recognition capabilities, and Lucina can be a non-pregnant or pregnant female that actually gives birth. When students have learning experiences in the inpatient suite, the students interact with the mannequins as they would a real human patient. Members of the simulation team voice the mannequins and manipulate the mannequins' physical states based on the actions and care provided by the students. The standardized patient suite is designed to resemble an outpatient clinic. Grand Valley has a very robust standardized patient program, with more than 200 pediatric and adult standardized patients. As mentioned earlier, standardized patients are community members that Grand Valley hires and trains to portray certain medical cases. The children that are a part of the pediatric standardized patient program never portray anything other than themselves. The standardized patient program offers GVSU students an opportunity to practice assessment and communication skills with real people. The Simulation Center contains a model living suite, which is a fully functioning replica of an apartment-like setting. Home health and end-of-life simulations are conducted in this space, along with students learning how to teach patients how to attend to their activities of daily living after a life-altering medical diagnosis or injury. Most high-fidelity and standardized patient events in the Simulation Center are recorded and live-streamed to faculty who are watching in real time. In the video system, faculty can make notations in the student's video of what they have done well and what they may need to work on. Also, students have access to their simulation videos to watch and evaluate their own performance. Similar to telehealth, the Simulation Center also conducts remote simulations utilizing both standardized patients and high-fidelity patient simulators. Students can attend simulation events remotely from their home while being able to interact and assess standardized patients virtually or direct the patient care of a high-fidelity patient simulator. I hope you have enjoyed this tour of the GVSU Interprofessional Simulation Center. As you have seen, GVSU students have access to so much in the Simulation Center that supplements and strengthens learning and skill development. The exciting news is that in the near future, GVSU students will have even greater learning experiences as the GVSU Health Campus is currently in the midst of a major expansion. By August of 2021, the Simulation Center will double in size, expand upon current spaces, and include a Plastinate Anatomy Lab, additional assessment labs, a simulated operating room, and several collaborative spaces designed specifically to foster interprofessional education. Thank you, and go Lakers!